Welcome everyone to our quarterly Hampden County Health Improvement Plan Network meeting. We thank you for joining us. We know we initially, attempted to have something in person, but better safe than sorry. So we're here on Zoom today, but really happy to be with you all. My name is Brittany Rosario. I work at Bay State Health as Community Benefits Specialist and have been working with the Hampden CHIP design team for the past 4 years in this role. So very excited to see all new faces and returning faces in this room. So before we start, I just wanted to acknowledge our design team members that are with us today. So if you could do the Zoom wave so folks can know kind of who you are. Anna, Malika, Becky, and a few others and maybe missing in Zoom squares. But we also wanted to just see, we know folks are writing their introductions in the chat, but if you are new, if you would wanna raise your hand or maybe use one of the reaction features that we have here on Zoom, we would love to just acknowledge any new folks that are joining a CHIP meeting for the first time. Awesome. So welcome, Jeff and Annie. Did I see your name? Awesome. Patrice. And I know a few of you, but if you would so oblige us. Jeff, would you like to just state quickly kind of where you're from?
Sure, I'm Jeff Hayden from Holyoke Community College. I'm a Holyoke resident and I work in the area of workforce development.
Wonderful. And Annie?
Sure. Hi, my name is Annie Connor. I'm an attorney with the Corey Criminal Record Reentry Unit at Community Legal Aid. We help folks with sealing and appealing housing denials because of their criminal record.
Thanks for joining us. And Patrice, would you like to introduce yourself to the full group?
Hi, everyone. I'm Patrice. I'm a pharmacist in the community at CVS and also a resident of Springfield. And this is my first time here.
Is any other folks joining us for the first time that want to do a quick introduction? We'd just love to recognize you.
I'll do one. My name's Kate Tyler. I am the outreach coordinator at Holyoke Medical Center for inpatient behavioral health. That's geriatric and adult units.
Awesome. Thanks, Kate. Alrighty. So we know there may be a few more folks trickling in as we go about our evening, but we want to, respect everyone's time. So Becky, not sure if you want to get us started with some of our slide deck presentations.
Make it louder.
Sure. Thanks, Brittany. Let's share my screen in a second. And I'm hoping my internet works today. It's been a little slow and jumpy, so just shout out if you can't hear me or something. Okay, so as Brittany said, this is our Hampden County Health Improvement Plan Network quarterly meeting. Great to see all of you, and I'm sorry for the confusion about whether this was in person or on Zoom. We just decided that logistically it was better to keep it on Zoom for this time, and we'll try to do something in person in the spring. So I'm going to give an overview of the CHIP for those of you new to this process, and with Brittany's help, go over sort of the process of the community health needs assessment, development, and how that works into the CHIP, and also the community engagement process. And then talk about some of the key health concerns that came out of the community health needs assessments for Hampden County, and our plan for updating the CHIP in the coming months. Then we're going to have some time for community team updates, just some highlights of work that has started with the CHIP and is sort of going beyond the CHIP, just to show how some of this work can leverage additional work and additional funding. And then we'll talk about some ideas for future discussions with community teams that have come out of some of the community team meetings. And then we'll have time for some breakout rooms to talk more about community engagement and how best to get people involved with this work. So community health improvement plan is a broad action-oriented strategic plan to improve the health of the community. And ideally it'll include 3 to 5 priority areas with goals, objectives, and strategies and measures to address them. And it will be implemented over the next 3 to 5 years. And it gives us opportunities for partnership, leveraging funding, and focusing to enhance impact. We developed the CHIP to serve community needs, respond to the results of the community assessments, in this case, the community health needs assessments, to coordinate and align strategies between organizations and programs, harness collective resources and political will, and establish a shared framework for community health. And this is the CHIP process model. It's really all centered around community engagement, engaging community in each step of the process. We're sort of at the prioritizing community health issues stage, which has happened both in the CHNA process and also just to confirm that in the CHIP process. And then we'll start to plan strategies going forward.
Yeah.
And I'm going to turn it to Brittany for to tell you about the CHNA process.
Thanks, Becky. So for folks who may not be as familiar with the term CHNA or Community Health Needs Assessment, it's a triennial report that not-for-profit hospitals and some insurers are required to do, as I said, every 3 years. So all of the Western Mass hospitals have recently published their 2022 Community Health Needs Assessments. So many of us, Bay State Health, and it's 4 hospitals, Mercy, Cooley Dickinson, Shriners Hospital for Children, and Health New England actually collaborated on the research approach for this report. And we were very excited that this year, Berkshire Health Systems actually joined us at the table as well a little later in the process, but we are what we call the coalition hospitals and insurers. And we also want to shout out our Holyoke Medical Center, who also does their own community health needs process and has been a partner with us over the past few years as well, in sharing a lot of our community engagement strategies as we go out and try to really assess what are the assets in our community, things that are keeping people well and healthy, and what are those areas of opportunity still. So in this process, we have the hospitals at the table, we have community members through all our different engagements, focus groups, key informant interviews, many consultants that help our hospitals respectively in this process. And I also want to give a shout out to what we call the Regional Advisory Council that works with the Coalition of Hospitals and Insurers, which is made up of residents, community-based organization leaders, and many others who help inform kind of the vision of the CHNA, how we go about our community engagement, and to the best that we can, try to integrate some decision-making at the community level. So those reports should be up on all our websites as of now. So if you're interested in doing a lot of reading, please go and visit. Hopefully today will be a nice summary of some of what we captured. And this CHNA really helps inform a lot of things. One being the CHIP, as Becky mentioned, and kind of looking countywide, what's being done, what's missing, and how as a county we can collaborate to either meet gaps or leverage some of the work that's already going on. Above, you'll see our hospitals are also required to develop an implementation strategy. So out of all the needs that we talk about in our reports, we're really advised to try to be strategic in terms of what that will be an area of focus for community benefits at the hospital level. So that could be programs, grants, and other ways that our hospital staff kind of do their community work. So Bay State Health has recently completed those, and those should be up on our websites soon in February. Some of our other hospitals already have those up on their sites. But something I just want to call out here is that youth mental health, you'll see, has been a huge issue countywide, Western Mass wide. So we're really excited to highlight that as a regional priority over the next 3 years for us. So you should see that highlighted in all our implementation strategies. And then lastly, in the bottom, you'll just see that other organizations also use our CHINA as a resource for their strategic planning, for their pursuit of grant dollars, to kind of provide another source of evidence for why they do what they do. So that's just a quick process overview for folks. And just to highlight community engagement, I have this one too. In Hampden County, we were able to do 11 what we call community chats, which are kind of informal, just really authentic conversations with folks. Our staff, go to these existing groups to learn about what they're seeing in their community. Just to compare, in 2019, we were able to do over 40 in Hampden County, and this year we're only able to do 11, and that was really just due to a lot of barriers from COVID, capacity, the people kind of cutting out a lot of in-person meetings, et cetera, et cetera. So with that, I just want to say there is a lot of opportunity still as we roll out our community health needs assessments and roll out our implementation strategies to do more community chats and have more community engagement. And I know that's, at the core of this CHIP as well. And then you'll see on the right some of the surveys and focus groups that we pursued here in the county.
Thanks, Brittany. And then just wanted to recognize the work that the Holyoke Medical Center did for their community engagement as well. So they held 11 community meetings, had over 30 stakeholder interviews, and did a community survey in both English and Spanish, and had 467 responses on that. And this just shows the service area for the Holyoke Medical Center. So the prioritized health concerns that came out of the community health needs assessments, there was a presentation at our last CHIP meeting, and there is a recording available on that. But just to summarize, social and economic factors, lack of resources to meet basic needs was a priority for Mercy, Bay State Medical Center, Bay State Noble, and Bay State Wing. I've put in blue some of the concerns that have not really been addressed by the CHIP in the past, just as something that we might want to consider looking at going forward. Financial health and well-being was another priority for Bay State Wing. Workforce development for Bay State Medical Center, violence and trauma for Bay State Medical Center and Bay State Wing. And barriers to health access was access to and availability of providers, and telehealth was a focus of Bay State Noble and Mercy. And telehealth, again, is one that we hadn't focused on in the past, but there's a very active digital equity alliance in Western Massachusetts working on that. And then health behaviors and outcomes, as Brittany said, youth mental health was a regional focus. Mental health and substance use was a focus at Mercy and Bay State Noble. Chronic conditions and other health outcomes didn't come out as a priority, but it is something that I think is addressed through a lot of our strategies. And I just want to point out that these are our priorities for the different hospitals. We don't have to choose these, but it's good if we can align some of our work with the hospital work, because there are also maybe some funding opportunities. So prioritized health concerns for Holyoke Medical Center include also mental health for all ages, as well as mental health in children, housing and homelessness, chronic illness, substance use disorder, food security, and then there are vulnerable populations to concentrate on were youth and seniors. This is a lovely theory of change model that Nicole, my intern from UMass, developed, just to show sort of our intention for updating the CHIP is to create a safe and welcoming space, acknowledging value in all voices and uplifting lived experiences of the communities that's encompassed by the CHIP, which is all of Hampden County. build understanding, trust, and a shared language around racism, which is one of the main root causes of most health inequities. Identifying priority concerns through data and engagement of partners and community members, and identifying upstream strategies to address priority health concerns. And so that means strategies that have a long-term impact, such as policy change, systems change, or environment change. We have been meeting as community teams. There's 4 different community teams: behavioral health, active living and healthy eating, primary care, wellness and preventative care, and violence and injury prevention. So in these community team meetings, we have discussions about current work and emerging topics, and we'll be developing and reviewing goals, objectives, and strategies. And anyone is welcome to attend any of these meetings. We do have stipends available for those of you who are not paid through your employer to do this work. And as part of our discussion about community engagement, right now these meetings are during the day, and so we want to know if there are folks who want to participate and can only do it in the evening, we'll figure out some way to do that. Our next steps for updating the CHIP in February and March will, at most community team meetings, we'll be inviting guest speakers on topics related to some of the key health concerns that haven't really been a focus of community teams to date. And the reason for that is we have been really working on implementation over the last couple of years. And so I think a few people who have, been interested in the overall topic areas, but not particularly involved with the strategy implementation themselves, have not been coming to all the community meetings. So we just want to broaden it out. And especially if you're working on an initiative or for another coalition and want to highlight some of the work you're doing, we definitely want you to be involved in this work as we're updating the CHIP. We'll also be looking at the outcomes of the strategies that were prioritized in the last CHIP for implementation, just looking at, did we achieve what we set out to do? Do we want to continue to prioritize this work in the updated CHIP? And is there an organization or coalition that can take the lead on that? And then we're going to have a next quarterly meeting in April, hoping to have it in person at a central location and fun and include food and informational materials from different organizations. So stay tuned for that. And then possibly inviting speakers on housing and transportation, some of those areas we haven't covered so far. And then we'll have some kind of a voting process to help us update the priorities for the CHIP. So we're just moving into the community team highlight presentations. And so I've asked each community team to highlight what are some highlights from work over the last year that might have started with the CHIP, and some started with CHIP funding for implementation. And it's been either or else it was an idea generated through the CHIP community teams. So what are some updates on outcomes or expansion of strategies? Were they able to leverage additional support and awareness for that work? And do you see this work continuing? And then we'll just talk about some ideas that have come out of some of the community team meetings for possible new strategies or building on existing strategies. So we'll start with community team 2, and I think Livana was going to present that. Are you good with that, Livana?
Yeah, I don't know if we want to pause before we kind of jump into this segment for anything or any questions.
Or does any, yeah,
there's a lot of information. So
yeah.
I just wanted to take a quick second to pause. If anyone has any questions or comments.
And Jeff, you still have your hand raised. I don't know if you have a question or just... Okay. All right, well, not seeing any questions, and also feel free to put questions in the chat. We'll try to keep an eye on that as well. So again. Okay.
Thanks, Becky. So with Community Team 2 and our focus on behavioral health, there's been a lot, I feel like, going on. I am going to be trying to my best to give a little bit of a summary on behalf of organizations, several partners and organizations that have been active in Community Team 2. So anyone who is part of our community team, please feel free to jump in with additional comments or information you want to share. So there's a few health concerns that we were really trying to develop strategies to address. One was around high rates of overdose deaths in Hampden County, and obviously substance use, and then also stigma not only around mental health, but I would also say substance use, and this would be especially for the Latina population. So our strategies will kind of reflect how we have started to focus there. So one of the things that we've tried to do is increase harm reduction and access to Narcan in Hampden County. So installing nalox boxes and which have Narcan as well as other supplies that anyone can access. Pedro, I think you're still on here, right? Do you want to share any details about how many boxes Tapestry has helped to put up?
Yeah, definitely. Thank you. So again, my name is Pedro Alvarez. I'm from Tapestry Health. I'm the Assistant Director for Urban Drug User Health at Tapestry. And in my role, I oversee our harm reduction program here in Western Mass. Getting involved with the CHIP, we were able to acquire some nalox boxes that we strategically put throughout the city. Again, these boxes, we wanted the public to have access to them. I feel like there is a number of agencies here that offer Narcan, can distribute Narcan. However, those agencies close at 4 or 5 o'clock. They're not open on the weekend. So again, we know the risk for overdose doesn't stop during business, not only after business hours. So again, that risk is still there. So we wanted to put up nalox boxes throughout Springfield. I'm sorry, I got distracted with a message. I'll get to you in that message too. Put them out throughout Springfield. Actually, we have 6 boxes up right now in Springfield. The first box that we put up, we partnered up with Open Door, so it's on the corner of School Street and State Street. The next box that we were able to put up was on the south end of Main Street. I believe it's referred to as the Monkey Wrench Building. So it's right outside their location. We have 2 boxes in the north end. One is actually on La Casita. It's a Gandara program, and then one's at the food pantry. We also have another box on East Columbus. There's a little homeless encampment under the highway, under the 391 bridge there. So again, having access to Narcan there for individuals that might need it. We were working with other communities to kind of put up other nalox boxes up outside of their locations. However, putting up the nalox box, we were asking agencies to host the box. They were interested in hosting the box. However, they don't own the building that they're located in. They were leasing. So again, one of the barriers that we faced was we don't have landlords or property owners that were okay with having the boxes up. Okay. I don't know if that was a question or something, but I'll just keep on. So again, we were able to contact businesses that were interested in hosting the box. However, one of the barriers that we faced there was they don't own the building. So again, it's having the conversations with the property owners about putting the box up. A lot of I wouldn't say a lot, but the majority of the properties here aren't local property owners either. So that was another barrier, is identifying the owners. Who can we talk to? Not the property management company, but the property owners. Another barrier that we face here at Tapestry was the Narcan itself for these boxes. So we get funding from Department of Public Health, BSAS, and other grants to acquire Narcan to distribute. However, there's some restrictions on who we can distribute that Narcan to. It has to be like a targeted population. So again, connecting with the CHIP, we were able to secure funding where we can purchase Narcan in bulk at a discounted rate to supply the nalox boxes throughout Springfield. There's been some good feedback from these boxes. We do check regularly when we go out on outreach. So again, we're checking the boxes to see if they need to be replaced, if there's any damage to the boxes, any Narcan's been used, but we got to restock it with Narcan, restock it with breathing masks and other supplies that we might have in there, or some of the information that we like leaving in the boxes for individuals. It helps having an agency that wants to host a box because they can let us know as soon as it's empty, if it's been damaged, if it's broken and needs some repairs. So it's great having that partnership as well. Seeing what else.
That's great, Pedro.
All right,
You're
I hear the music.
definitely reach out to Pedro if you're interested in hosting a box, because he
definitely.
knows it all.
I'll add my contact information to the chat. If anybody's interested in hosting an Unlock box, wants to learn more about Narcan and what we do for work here, please feel free to reach out. If anyone's interested, I know we have a lot of different agencies, organizations here, people from the community kind of representing. If anyone's interested in a Narcan training, learning how to use Narcan, respond to and over those, please feel free to reach out.
Yeah, thanks, Pedro.
Yeah, no, definitely. Thank you.
And one of the other things that has grown out of some of the work that Community Team 2 has done to really continue harm reduction efforts is through a NACCHO grant that I'll give some very high level overview of in a minute, and some of the other Narcan and naloxone work that's been done through that grant and that funding. Another thing that started with this Community Team 2 was an anti-stigma campaign called Break the Stigma, and it's a bilingual and English and Spanish campaign. So Sin Estigma is the Spanish version of it. And that launched actually back in 2021. So I can't believe we've already seen more than a full year. And the goal was really to reduce stigma around substance use and mental health, and have it be bilingual and promoted. So it was on radio, Bomba Radio, to really reach Spanish-speaking populations in our area. And then I'll talk briefly about how NACCHO is taking that to another level and what you can expect for that, which we're really excited about. And then unfortunately, we don't have Isabel Garcia here from Estoy Aqui, who's been a huge champion for bringing training and conversation to in our communities around mental health and suicide prevention. So she developed La Cultura Sana training that she did with over 45 cultural responders. So these are people like hairdressers, doulas, and other people who really engage with community members, but they're not mental health professionals, but they're talking to people all the time and really building connections with community members in a way that's really important. And so having more conversations with them about what they're seeing and learning, but also giving them resources and information that can be helpful for folks that are struggling with a behavioral health issue. So that was really great. And I think, Becky, you can maybe go to the next slide.
Yeah, Ivana, we're actually timed.
Oh, okay.
We can share these slides if you want to just take a minute, but I want to also.
Yeah, well, I wasn't going to go over this whole slide. I just wanted to highlight the partners that we were asked or that we were invited to for this funding opportunity, which was great. And these 5 partners signed on with us to really implement this work. And so I just wanted to really call out the Break the Stigma campaign that's going to be launched in February on TV, radio, social media, billboards, with voices of people with lived experience that we're really excited about. And I hope will resonate well for people in the community. Again, it's going to be bilingual, so please be on the lookout for that. And then the other part that I just want to highlight about NACCHO is that it really was, the goal of this grant was not just a focus on urban parts of Hampden County, but rural too. So I'm not sure if we have any representatives here from some of the more rural, whether western or eastern parts of the county, but a lot of the Northampton DART team is working with those parts of the community in particular, as well as some of the urban parts, but on providing more naloxone boxes, Narcan, And Quabog Hill Substance Use Alliance is also going to be conducting a lot of Narcan trainings in those areas. So it's really great that I think we're, with a combined effort with NACCHO and the CHIP, really saturating that a bit more.
Thanks, Ivana. So we had a couple other slides, but I will, I think we're going to do a newsletter. And this is some more on Isabel's work with La Cultura Sana. I'll put that in a newsletter coming up. And she also offers a number of trainings that are available for any organization that wants to do that. And then also we'll put this in a newsletter with some other potential strategies for moving forward. So community team 3, my presenter was out sick today or with a family emergency, so I'll just go through this quickly. So community team 3 is primary care, wellness, and preventative care. Some of the health concerns we addressed were high rates of sexually transmitted infections, particularly among young women, particularly Latina, and also lack of access to health care and the low number of primary care physicians and overuse of the emergency departments for non-emergent conditions. We funded through CHIP funding 3 different projects: the STRIVE Youth Participatory Action Research Project. That was a big part of a presentation at the last CHIP meeting, I guess in May, and provided some really great photos and the voices of youth in Springfield and Holyoke. We had some peer-led trainings. We prioritized peer-led sex ed type trainings, and we're working with Planned Parenthood for a while on that, and that for various reasons didn't come together. So we used some funding for Girls Inc. of the Valley, and they funded a teen council, which comes together and decides on different topic areas and then provides programming for younger kids on those topics that they choose. And then community health worker trainings and involvement in CHIP work. We had 3 community health workers stipended through CHIP funds who continue to be involved in our meetings, and really great to have them on board as the sort of boots on the ground, people that see people every day and understand what a lot of the needs are. And so just some highlights from these. So the photo voice, I'll show in a minute one of the illustrations, and they had some good key findings that we want to consider in the CHIP update. The expanded awareness of peer-led trainings is expanding at Girls Inc. And that's something again that comes up in a lot of different groups, is just opportunities for youth and peer-led help types of support groups. Okay, and then one other highlight from the community health worker involvement, we did get an intern to develop a report on the use of CHWs in emergency departments to reduce the number of visits there and help people access healthcare. And Nicole, I can't hear you, so just let me know if I'm over time. I haven't seen. So this is one photo from the STRIVE project called Gray Rainbow. And it says, this photo shows a colorful girl in a not so colorful place, clutching her comfort toy. As colorful as I am, where I am is so desolate, alone, and depressing. No matter how hard I try, I can't be happy. We all put a smile on, even when we don't feel like smiling. Depression comes from our environment, people, places, events, etc. The photo shows my efforts to be bright and cheery, but it doesn't change how I feel mentally. The anxiety and depression will always be here. People need to take depression seriously. So this came out of the Youth Photo Voice project, and I think is a great illustration of youth mental health and how environment and built environment can affect mental health. And then some of the key findings were raise awareness of social services and sexual health resources available to historically marginalized youth, engage youth equitably in planning and decision-making, increase access to school-based programs to foster adult social support, to address interconnected structural factors such as housing, transportation, and increase access to sex ed rooted in cultural centered frameworks, and collaboration between youth serving community organizations and school districts. And then this was just some more on Girls Inc. Because we ran out of time at the last meeting, but I won't go through all of this. Just they did a teen advocacy board with training on healthy relationships and building, and it helped to build youth skills and to educate their peers. And they're hoping to expand the project in the fall, or I guess it was last fall. And then this is more on community health workers. There were trainings with the Community Health Worker Coalition that Brenda Evans coordinates, and she trained 50 community health workers in various trainings. Again, 3 regularly attend community team meetings, and we hired an intern to do some research on community health workers in emergency rooms. And then just some of our looking forward, these were some of the findings from the YPAR project, and also have been talking about community-based CHW training programs and opportunities for leadership and advancement of community health worker careers. Wellness on Wheels is a big one that has not been mentioned in the CHIP, but is something Bay State is running, and will potentially have a community health worker on board to bring programming into communities with less access. Digital Equity Alliance is another one that is addressing access through digital world, and then just increasing access to school-based programs. That was from the YPAR project. So now we're on to Community Team 4. Can't see if any of my cohort is here. I guess Anna is here. I'll go over this first part, and then I might have Anna, if you can jump in on the Feeding America grant. So Team 4 is active living, healthy eating. We've been focused mostly on high rates of food insecurity and food-related chronic diseases that can be addressed in part by both diet and exercise. We've had strategies including HIP outreach and education. It's the Healthy Incentives Program to really train service providers on how to talk to clients about HIP. And Liz Ogilvie will talk about that a little more. I'm not sure if you're here, Liz. Maybe some highlights. Let's see Liz yet. And then the bilingual Holyoke Farmers Market coach, they started with a mini grant and have expanded quite a bit through a grant from Feeding America program, and I'll show that on the next slide. And then we're also been talking about supporting long-term sustainability of farmers markets as places to access the HIP program and healthy food, and also opportunities to socialize and start new businesses. So just some of the highlights of the HIP work. Liz Ogilvie has been participating at state and national levels to promote permanent funding of HIP, both in Massachusetts, and to adopt HIP as a federal program. She actually was in Washington last week and met with President Biden, and I'm sorry she's not here to tell that story. And then the Feeding America grant was obtained through the Food Bank of Western Mass and the Women's Fund, and it's to promote expansion of farmers market coaches. Anna, do you want to say more about that? This is all the partners as part of the Feeding America grant.
Yeah, we are very excited about this new partnership, a collaboration, because finally we have not only Holyoke-based organization, but we are expanding to Hampden County. Right now, we are in conversation with Westfield and Chicopee also to do farmer program created to really through the farmer market system. Something that for a lot of us is really normal to go to a farmer market. We find out many years ago that is very intimidating for our community to really go to the farmer markets and try to get familiar not only with the process, but with many different vegetables that are the farmer market coach by nature. We are trying bilingual services.
You're cutting out a little, Anna.
Goal is on the hip and it's not helping to promote the farmer market. Do a lot of recipes, share and talk to the owners to one of program as well of the healthy lifestyle programs that are through our partners.
Thanks, Anna. You're cutting in and out a little bit, but I think our time's up for this one, and we'll move on to team 5 just so we have time for the next one.
Yeah, in Colombia, guys.
Yeah, I really appreciate you being here, Anna, from Colombia. Thanks. So we will, again, more on the potential other projects going forward. One of them is to start a Hampden County Food Policy Council, since we all work together so well, and Let's Move Hampden County has already started sort of in that route in the Springfield Food Policy Council. So that's one of our potential strategies going forward. Okay, team 5, Tiffany.
Sure. Good evening, everyone. So Community Team 5 is the violence and injury prevention team. We've mainly been focusing on mentorship as a preventative method for violence and injury. Some of the health concerns that brought about this team were the high rates of violent crime and also the high rates of domestic violence. Some strategies that we have been working on are to increase awareness about the positive impacts of mentor relationships. That's what we did via the Mentoring Summit in the first year of implementation. We continue to promote and grow mentoring programs, and then also spreading awareness through the mentor ad campaign, which is intended to increase traffic onto the 413cares.org page in particular. So some highlights from the last couple of years are that we were able to launch the mentoring ad campaign, which I will show you a clip of that in a moment. And also the Youth Mental Health Coalition. I'm the Youth Mental Health Coalition Manager, which is convened by the Public Health Institute of Western Mass. And one of the strategies of the Youth Mental Health Coalition, is to support mentoring organizations so that they are able to develop and build more mentoring relationships in the Springfield community. And this is something that came at the request of our youth, that they are looking for more opportunities for mentorship. And so with that sort of as a main strategy for the Youth Mental Health Coalition, we sort of adopted some of the members of Community Team 5's mentor group and created the Peer Mentoring Collaborative, which really focuses on how we can support mentors and mentees in mentoring relationships so that we can, make them more sustainable and be able to increase the amount of mentorship relationships in this area. Next slide. And so since the campaign launched in October, we are able to see that it was the second most visited page with 1,155 views. And it was also the fourth WWLP, which is the main way that this ad was advertised, was through WWLP, and it was the fourth source of visitors to the site, which we believe can be attributed to the mentoring ads that were playing on that channel. And so I will go ahead and quickly show you. Hold on 1 second.
Caring adults in our community to share your talent, time, and expertise with a young person through the 413 Cares community online resource portal. Mentors are needed to help young people grow, develop, and better prepare themselves for life's challenges and opportunities. A caring adult can make all the difference in a young person's life. 413cares.org connects people in need with available resources like mentoring. Learn more and sign up to mentor a young person who needs the support at 413cares.org.
Okay. Yes, so that was the mentoring ad that we were able to develop with funds from, partly with funds from the CHIP. And we're really excited to continue building out that mentoring page. So if there are any mentoring organizations on the call now, or just in general, we ask that you continue to encourage folks to go on to 413 Cares and list their organizations so that we can really have a robust offering for families that are looking for mentorship opportunities. And I wanted to just break and see if there was anyone else on the team that wanted to share more about mentoring. I think.
Yeah, we just have a minute and then we're gonna go into break.
Oh, okay.
Dirk, were you getting ready to unmute?
So as you can see here, as Tiffany just mentioned, we are looking to continue to expand in support of those mentoring programs. We also have been exploring and discussing other topics, Holyoke and Springfield hub programs, supporting wraparound services, the Better Tomorrow program, collaboration, and of course, supporting therapeutic mentoring and involving community-based organizations. For next month, we actually will have, I think Becky mentioned this a little earlier, that we will have someone at our next Team 5 meeting to talk more about domestic violence. So we are continuing to look at a number of additional topics. So if you do have another thought or a suggestion, we are definitely open for that continued discussion and exploration.
Thanks, Malka. So we're now getting ready to break into breakout groups. If anyone has any questions in the meantime, go right ahead while I try to put people in different rooms, and just feel free to unmute. So the questions will be on some Jamboards, and so if anyone's familiar with Jamboards, I'm going to put the link in the chat now, and you can go ahead and we'll have different rooms in just a second. Let's see. Okay. I'm just gonna do 4 rooms. Oops. Okay.
Becky, can you remind me, are we dismissing from the breakout groups or coming back?
We will come back after 20 minutes.
Thank you.
I'm good. I'm good.
Good. Thank you for asking.
No, definitely. So, Becky, I'm glad you're on the room with us because I forgot the questions. So,
Well, I
if you
found
can help us out,
the question.
that'd be great.
Yeah, and I'm just gonna change this because Sasha was supposed to be here. So the questions are, when and how should we engage community members in the work of the CHIP? And let me just put the Jamboard in here. If you want to look at that, and I'll also share, or does someone, Nicole, do you want to take notes on the Jamboard?
Yeah. Are we looking at breakout room 3
Yeah,
or 4? Okay, just checking.
I probably have my name in a couple of. What room are we? Are we 4? Oh,
It's 4, I think.
okay. Oops. Okay. So I can share my screen. Well, why don't we just, yeah, I'll share my screen and we can kind of look at it. Okay. See that?
Yes.
Also, if you have it open, you can also put it in there. But so the question is, like, you know, we had this meeting at 5 to in hopes of getting some community members here. And Patrice, I'm very glad that you're here with us. I assume you would qualify as a community member. And so it'd be great if you want to speak to that, or anyone else on just, you know, how to make this a welcoming space for people to.
Sure. So the way that I found out about the meeting was through the newsletter from the Public Health Institute, I think. So I'm part of the newsletter. That's how I found out. And I did share it on Facebook. I think having the meetings, you know, after work would help to get more people here. Just because, you know, a lot of people, you know, are at work and, you know, they have kids and stuff like that that they have to pick up and do things with. And I'm just trying to think, like, how else could we get people? I think, like, just trying to contact them at, like, maybe like the community centers and like churches, because I think those are like places that people, a lot of people go to that usually aren't reached out to. So those are my ideas.
Great ideas. I like the idea of meeting people where they're at. You know, the fact that you're meeting them at church, meeting them. I'd go as far as meeting them at the supermarket, meeting them at, you know, quite a different places. You know, some of the work that we do here is a lot of that outreach, that community outreach, and meeting people where they're at and engaging them, and you know, giving them information about what we might have going on. When I think about the CHIP, like, you learned about the meeting from a newsletter. A lot of people don't have access to that newsletter, or don't know about that newsletter, whether if it's electronically, they don't have access to that, or they're not too technology savvy, so they're kind of missing out on a lot of information, you know. I think about older generation. I think younger generation, they got cell phones in the palm of their hands out the womb. So that's a different story. But older folks like myself, you know, we might not be so technology savvy. So you have to meet people where they're at with that. And, you know, meeting them at churches, meeting them at supermarkets, meeting them where there's gatherings of folks, and just having that conversation, whether you're setting up a table and providing information that way, or just, you know, trying to greet people as they're walking by and handing them information. So those were great suggestions.
Yeah, to kind of piggyback on what Pedro was just mentioning, I was thinking of, you know, perhaps we have some type of postcard or something that these organizations that are involved in the different community teams can be handing out at the different tabling events that they do, the community is at. I think about the MLK event that we recently participated in. There was, you know, a ton of families there, you know, from young to our seasoned grandmas and grandpas. So making it, you know, having some type of postcard maybe with like a description of the different community teams and how community can get involved might be helpful. We can share them with this, you know, places that Patrice mentioned, like the churches and laundromats and things like that, right?
And one thing you mentioned that kind of brought something to my mind too was with like the cards when you mentioned, because a lot of, you know, organizations, agencies, community centers, faith-based organizations, whatever the case may be, a lot of them have community boards where you can put the flyers up on these boards, you know, and people are reading those, you know, people see those all the time. We have a community board at our locations, and we have, you know, half the stuff, most of the stuff on this board ain't even ours. It's from different organizations that we work with, different resources in the community, because we want to share that. You know, I feel like information is very valuable if you know about it. You know, but if you don't, then that's a different story and you kind of lose out. So definitely any ways we can get information on is great.
I do also think the start time, like moving it back to 5 o'clock, I think is better, right? But I think people are just getting off at 5. Or sports, you know, I have to pick my daughter up from school around 5 after her practice is over. So I actually moved one of my coalition meetings to 5 o'clock, and I'm moving it back up to 4 o'clock. I moved it to 5 to accommodate the youth, but it was not working for professionals that needed to be there. So then we just have some representatives of the youth come at 4 o'clock. So it's hard.
Yeah, that timing is always a challenge.
Yeah.
You know, life happens, people got stuff going on. It's tough. And then again, you have which population do you want, you know, involved in these meetings? You want everybody there. So it's having that ideal time is always tough to kind of find that middle ground.
Yeah, do you think do people want to be involved in all of the meetings, or you know, would it make sense to have just sort of a few public meetings after working hours? I guess that's a question, because we do meet monthly, and you know, I wouldn't want to lose professionals who are there as part of their work also. So that's sort of a balance too.
I think that's a good idea, maybe to have like a couple of meetings open for the community that are maybe a little bit later. You should maybe also want to think about like having food, like provide like a dinner, or, you know, maybe like a sitting service just for like, you know, families that want to come and maybe, you know, they don't have anyone to watch the kids or something like that. So that would be a good idea if you did it like quarterly or something like that, just so that, you know, the people that you may not get during the daytime at least would have an option to come and give their opinions and things like that.
We're thinking of having an in-person meeting in the spring, and I would really like to have it in a central location, you know, probably in Springfield. we were going to have this meeting at PVPC, but we're still have locked doors. So it makes it not as welcoming, and you need someone to let people in the door and stuff. So are there any spaces that you all know of that are good? I know libraries sometimes have space.
Library, UMass building downtown with Tower Square. They have like some space there. I know they host like the HCAT meetings there, other community meetings there as well. And it is a pretty big space.
Maybe schools. I don't know what's open in the
Oh yeah,
evening.
schools are a good idea. You can just yeah, you can do it. Schools are, you just have to do a permit for it. They're fairly easy to do.
Yeah, libraries, most libraries have community rooms you can reserve. They have a calendar.
I think it matters too, how we're sharing about the CHIP to community, because it's not a very common thing, or and it's an easy thing to grasp. Like Patrice, I'm curious to know if this is your first meeting, how your understanding is of the CHIP. Because I know when I started just as a staff person at PHI and doing this work, it took a little bit for me to sort of wrap my head around everything that was happening with the CHIP. And so, I'd be curious to know what you think. And then two, I think it just, we have to be very cognizant of how we're talking about CHIP and making sure that community really understands what we're asking them to do when we're inviting them to come to these meetings.
So that's a very good point. So first, let me just give you a little bit of background. So I'm a pharmacist. So, like some of these things, we talk about all the time, but I was also a grant reviewer for Bay State and for Health New England. So
okay, so you've got some background.
Yeah, so I kind of have like a little bit of background. Like it's not like so confusing, but I can definitely understand like someone just coming in off the street would be like, what are you talking about? So that is definitely a good point to like try to explain it in a way that makes sense to them, that they understand, like, why is this important? I think if you couch it in terms of, it's about your health and we want to get, like your opinion, your voice matters. We want to hear what you're concerned about. That definitely like opens the door for people to come in and at least hear, like what we're trying to explain or talk about.
Cool, thank you.
Sure.
Yes.
Helpful. Yeah, I'm thinking about like as we develop strategies, it might be good to get some reflection on that from community members. But also even at this point, do these health concerns sort of resonate with people? And what are the main health concerns that they're seeing within their communities? So do you think public meetings are really the best way to do that, or surveys?
I'm a big fan of in-person public meetings. I think they're a lot more effective at times. Zoom definitely, I think a lot of people have adapted to that because of COVID, and become kind of pretty good with Zoom. And the benefits of Zoom, you don't have to be there physically. We're all kind of sitting somewhere else right now and can just meet up. And that's the great part about it. But the in-person is always, you get to meet people and you get to have that conversation. It's a lot more intimate. And you get an opportunity to kind of talk amongst, other people. Like we can't have too many side conversations right now while the meeting's going on. And you really get to know people that way and make that connection with folks. So I'm big on human connection. In-person meetings are great. But I see the benefits of the Zoom, and it's 6 o'clock and we're all meeting here today in different locations, which is great. Surveys are always great, but again, it's who are you reaching with these surveys? Who are these surveys for? You got to think about the demographics and the engagement that you want to get out of people with surveys too. So cabs are good too. I'm part of a few cabs, community advisory boards, but it's good to get actual members of the community involved in these cabs. And you get the real stories from folks and what some of the real concerns are. And it's difficult because again, Springfield is pretty diverse. You have many different languages that are spoken here, many different cultures here as well. It's got to be inclusive for all of that and make people, feel welcome.
You guys have a community advisory board, Pedro, at Tapestry?
At Tapestry, we have a consumer advisory board. So it's made up of participants, and they kind of meet and have conversations. Some of them conversations are, we pose questions to this consumer advisory board, and we do surveys. Yeah, but we get a lot of information from that, and it kind of structures in some way of the way we kind of operate and what we offer for services and that engagement as well.
Yeah, language is a big one. I know we've tried surveys in Spanish, and it's always, how do you get the word out about the survey if you're not translating everything? And it's a real weakness I think we have so far. What are you guys doing at the Public Health Institute, Tiffany? I think your newsletters are now bilingual, right? Do you do meetings in Spanish also?
We do not host any meetings in Spanish. We've done, not through my coalition, but we've done some like translation, I think, in the past. We do have our newsletter in Spanish. Our website goes to Spanish also. One of our coalitions, like the Live Well Springfield Coalition, has a resident advisory board. That's a newer thing that we are doing more with. Yeah.
I think we are close to time. Let's see. Oh, we have 2 minutes. What else have we not covered? Does anyone want to report on this out to the group? From Nicole's great notes here.
Oh, look at the time.
Already presented today.
I can do it.
Okay.
Ooh, Nicole, is that what
So that, Nicole? Okay.
I know you took the notes and you're taking one for
Yeah.
the team right now, Nicole. Appreciate you
Anytime.
representing Team 4.
Yay, Nicole. Anything else? Let's see. Surveys.
The only thing I think I would say about surveys is, I think it would be hard to, unless we had like each community team had specific things that they're surveying about. But just to my earlier point, I think it would be difficult for the whole CHIP to do a survey because it would just take so much to explain what it is, and I don't know if people are going to read that much.
Yeah, it might be more of like, what are the priority health concerns, just some of the.
Yeah, or maybe like at a community event, if we did like community events at libraries in different communities, invite folks to come out, do some explanation, and then do a survey around what we shared with them.
Okay, that's a good point. Okay, I'm gonna close the rooms now, I think, because we only have 15 minutes left. Okay, well, I'll see you back out there.
All righty.
All right, thank you.
Bye.
I forgot to leave the breakout room. I was in there all by myself. Okay. One should be back in a second. There's Monica. All right, I think everyone, I'm not sure if everyone is back. I think some people jumped out.
No. Yeah, I think yeah, here they come.
There we go.
I
Okay.
think it's just a little slow.
Yeah. You want me to share the screen with the Jamboards or just report out? There.
Well, I can report out my notes. I mean, I think they're
Okay.
semi-clear, but.
All right, well, let's start with Malika's group. Did you want to report, Malika, or someone else? Where'd you go? Oh, you're muted.
I get used to talking to myself all the time now. So just to think about some of the questions, I'm just going to, if it's okay with the group, highlight a couple of things that we briefly talked about. One of the things was that, let me see, engage with other organizations, seek out to engage faith-based leaders. And then one of the thoughts is how should we engage members, engage community members in the work of the CHIP. That was some of the thought: engage with other organizations, faith-based leaders, and individual members taking some type of responsibility and sharing information on the CHIP, and share information on how, if someone's interested, how they could be a part of the CHIP. And that actually flows into some thought around having like maybe a one pager, a folding type brochure that is simple, quick to the point, that can be shared with people as we attend community events and other meetings. We had thoughts around social media, utilizing direct email lists, again, social media, and try to think about as many barriers as possible. And then how do we systematically try to break down some of those barriers that would prevent someone from attending. And then the other thing was on the physical material, or even on social media, so forth, to develop like a QR code or something like that, that could take people immediately to information. And then just thinking about how do we meet in terms of being flexible to meet the needs of the community members. So that was some of the discussion that we had. Did I forget anything? Did I leave anything out, guys? Okay, thank you.
Brittany, your team.
Okay. Yeah, similarly, just really quick, some things that we talked about was taking advantage of maybe door-to-door approaches to engagement with folks, as applicable, whether that's within strategies or inviting folks to some of our quarterly meetings and learning information. So folks talked about their respective success and using that model to engage people. And in doing that, and then just in general, being mindful of language again and ensuring that we have native speakers as much as possible, or people who are very familiar with various languages, whether it's Spanish or I know we've talked about Russian and some other common languages spoken in our area. People talked about social media as well, and using that especially when sharing our story through photos. So maybe thinking about how photos and videos on social media might attract more attention to this group and the work that we're doing, meeting people where they're at. Some other things in terms of like meeting structure. A really nice proposal that was brought up was maybe having some set, like one morning meeting and one evening meeting that rotates month to month, but that shares consistent information. So people who have, people can select which option works better for them. Thinking about engagement with the schools as a way to take advantage of meeting people where they're at. And yes, and revisiting membership and advertising. So a lot of us are in this space because our jobs told us to be in this space, if we're just being frank. But finding, I thought someone referenced like a pamphlet or something that we can use to say, why as a resident or why as someone that may not have been asked by their job to engage with us, why should they be here and how is it mutually beneficial? And I'll just stop there.
Levon, I know you have to leave. Do you have someone reporting for you, or do you want to report out?
We didn't officially assign anybody. So I think there's been some great ideas shared. I think we talked about just the challenges of scheduling between, residents of community members and professionals. And so developing like a community council under the CHIP and having some liaison between those could be helpful to have space for the unique pieces that we might want to engage community members, like more, that aren't coming from that professional space on could be helpful. I also agree that more promotion of what the CHIP is and just getting into those spaces like Brittany and Malika identified some great ideas could be helpful. Why we want more people involved, what it is, what the goals are, what the expectations are, what the incentives are. And I also think, I just thought of adding like building out a page for new members on the website could be helpful and kind of giving them a, here's kind of that overview, what you need to know, what ways to get involved could be helpful. And the QR code could potentially link there as well. And then hold on, I have to flip back to does my group want to chime in with anything else? I also think there might be existing groups to liaise with, like Dirk had mentioned, beat the odds. There's different youth groups, or there's different other groups that exist, and connecting with them more, building some sort of relationship, whether they become members or someone from those groups become members or not. And then I just also think including rural parts of the county and strategizing in a way that can reach rural parts, not just the urban centers of Hampden County, would be important, which may be somewhat of the same strategies, but also maybe a little different. I know Quaybog is developing their own CHIP, but I think figuring out how that plays into what we're doing too, and figuring out what that relationship looks like would be helpful.
Yeah, thank you. It's a good point. Nicole, you want to report for Team 3?
Yes. So we had one community member who found out about it, this meeting through our newsletter. So then we talked more about how not everyone has technology or access to the newsletter. So really promotion and like building it out, and the importance of printed materials, especially there's so many intergenerational events that happen in the communities. So getting information to all age groups is important. We talked about getting information onto community boards at faith-based organizations and things like that. And then just a little bit, we talked about how 5 o'clock start time kind of overlaps with children's schedules, people leaving for work, and the importance of maybe getting people back in person and incentivizing them with food, maybe like a sitter service, in-person quarterly meetings. And then we talked a little bit about the idea of like who we would survey if we wanted to survey, and who do we want to attend the meetings. So just really important in the language we choose in our like printed and digital materials. And I think that's about it. Oh, and we also talked about translating our materials into different languages a bit, but we didn't get far with that.
Something we definitely need to work on. Okay, so thank you all for coming. Are there any other comments from anyone who was part of this? Next steps will scheduling community team meetings with speakers going forward, and we will, I think, have this conversation in community team meetings. I like the idea of every other month sort of having changing the times around, but I really appreciate all the input on this, and we'll bring it to the design team and community teams to think about better forms of engagement going forward. And we will be launching the website soon. It has a calendar. It's going to have a calendar with community meeting dates, and we'll put topics on there too. So hopefully it'll be easier for people to find it if you're not on our email list. And I think that's it. So really appreciate everyone for coming out this evening, and have a good rest of your evening. I don't think I see any questions here. Yeah.
Thank you.
Oh, the individual, I think Patrice.
There is a question.
Oh,
Yeah.
Patrice, sorry.
When are the community team meetings? They vary on different schedules depending which one you want to engage with. So we'll be sure to send you a personal email with that list.
Yeah, thanks, Patrice. Anyone else who's here for the first time who wants to do a community team meeting?
Maybe we could send that to all the folks that identified it was their first time too.
Yeah, okay, great. All right, thanks everyone.
Have a good one.
Bye.